A pleasant 65 degrees on this Wednesday, June 5th, 2019. Calvin Castine in Plattsburgh. Smithfield Boulevard is over that way, and over this way in that direction is Route 3, and we're here for the official opening ceremonies. Although they've been opening for a number of weeks, we are here for the official opening ceremonies at the Hudson Headwaters Family Health Center here in Plattsburgh. We're expecting Joey Trombley to join us, and we'll find out what the program has in store for us as we get going here momentarily.
Well, I'm Joey Trombley, and I made it to Plattsburgh, Calvin, and this is the second time that we have done an interview with Hudson Headwaters, and I'm with Dr. Tucker Slingerland. And of course, Doctor, we talked to you back up north when you opened up Hudson Headwaters up in Champlain. So I guess we call this Hudson Headwaters 2? North of Glens Falls area?
We actually have 18 health centers spread between just north of Saratoga all the way up to Champlain.
So this is number 18?
It is, yep.
Wow. Yeah. Now, was Champlain incorporated with CBPH also, or is this one incorporated with CBPH?
Yeah, so this building, like the one in Champlain, involved a huge amount of overlap with CBPH. And in Champlain, Hudson Headwaters built the building, and part of it is committed to CBPH for all the ancillary services, the labs, the imaging, which made it really convenient for patients. At this building, built by CBPH, University of Vermont Health Network, and our task is really to operate the medical services within the building. But with that, we also had a great opportunity to position things so that we could really take full advantage of the services already established here by CBPH and the University of Vermont Health Network. So, this building is right in front of a huge spread of ancillary services, really just across the hallway. So patients don't even have to go outside to get a lot of those services.
So how long was this building in the works?
We planned this at least for 2 years. It was probably a 2 or 3 year planning project.
So Champlain was first, and once the ground broke there, then you started on this one?
Yeah, we started here, and we used a lot of the same workflows and the teams at CBPH and Hudson Headwaters. They're the same people, and we got good at working together and figuring out how to design buildings and the size of them and really what the need was. And we knew that we wanted to have something that could accommodate approximately 12 providers because we really felt that there was a need here in Plattsburgh as well as Champlain. But so we started there, and we've been open here 4 months now, and we have had at least almost 2,000 individual patients come here for well over 3,000, almost 4,000 encounters. So, at this point, amazingly, within 4 months, we are seeing almost 1,000 patients a month here.
I know Champlain was a success story, and it still is a success story.
Yeah.
Because their numbers increased tremendously up there.
So this is clearly meeting a need. We're put a lot of thought again into the location. It's on the bus line, so we've been really lucky that people can find us and get here. And we are absolutely open to accept new patients and new families, including little kids and the full spectrum all the way up to older adults.
Now, do you have the employees? Can they move around within Hudson Headwaters?
Yeah, we have some movement within the network. The folks up in Champlain actually spend a lot of time training the staff that's working here. So they almost work like sister health centers. But most of the people that are working here in this building work exclusively here. And to start, we have about 22 people working in this building, and that's those were jobs and positions that really didn't exist here before. So we're really happy about the economic impact that'll have.
Now, how does this building rate in comparison to Champlain size-wise, and what can be done, and number of employees?
They're about the same size. Champlain might be a little bit bigger just because it's in the middle of a farm field and had room to grow, but to build. But about the same size, and this is of the scale that we've been building in other locations. We're building the building at exit 17 on the Northway in Moreau. That's this size, but we also have some small health centers in places like Indian Lake and North Creek, which look more, feel like a much smaller office, but that meets the need of that community.
Right. But you guys have really focused, obviously, on rural healthcare, and that's what started all this.
Yeah, definitely. We're first and foremost an organization focused on primary care, and we provide a lot of care in some very remote locations across the Adirondacks and surrounding communities.
Right.
But also more urban locations like Plattsburgh and Glens Falls.
Right.
And we define primary care pretty broadly. We do women's health, we do podiatry, we do pediatrics, we do mental health counseling, and so we feel, that those are the needs. But our focus is exclusively on the outpatient work, and working closely with the hospital, our hospital partners, to make sure that the healthcare needs are met for communities.
Well, I mean, because there was obviously, you're filling a void that was obviously neglected for a long time.
Yeah, I think healthcare is changing, and it's very fluid right now, and there are real opportunities to meet community needs, but it takes problem solving. It takes working really closely with hospital partners, with university partners, with mental health partners. So that's really what we've been doing, focusing our attention on, is finding like-minded folks and then going from there.
Now, your specialty is primary care yourself?
I'm a family doctor.
Okay.
I see patients every week,
okay.
and I think that helps ground me in the business.
And you work out of where?
Warrensburg Health Center,
yeah.
And our West Mountain Health Center in Queensbury.
So other than the grand openings, you get a chance to come visit these other...
I do, actually. I was here the first day they saw patients.
Okay.
I saw a few patients myself here.
Yeah.
Got to meet some folks who hadn't been able to really access care for a while, so that felt really great. And I knew then, even with those first two patients, that this was going to be a hit. And in the process, I've gotten to know the leadership at CVPH, at the University of Vermont Health Network, CVPH's board, all really, really supportive of, working together and meeting the need of the community.
That doesn't surprise me at all, because that is the North Country.
Yeah,
they do come together for whatever cause, and they do make it work.
Yeah,
and I think your experience, whether Champlain or here, has obviously been a pleasant one.
Oh yeah, I think we all have an opportunity to try to come up with solutions ourselves, and we could wait for things to fall into place, but I think being proactive, meeting community needs, thinking about what else we can do to strengthen communities is really important.
So I know you're going up to exit 17. Is there any plans to go farther west from here to Ellenburg, Malone, any areas out that way?
Yeah, we're always open to conversations around primary care, really anywhere. We have a couple of real big projects right now.
So exit 17. Are there more on besides exit 17?
Yeah, so we're remodeling a women's health building in Glens Falls. We're rebuilding our pediatric space in Queensbury, and probably most importantly, working with Elizabethtown Community Hospital.
Nice.
We'll be building a new health center in Ticonderoga to move our existing health center into. That's on the Elizabethtown Ticonderoga campus. So that'll be a big building, and but it's integrated in a lot of ways that this building is.
So besides tending to patients, you're directly involved in all this too?
Yeah, that's what we do, and we enjoy doing it, and we've got a good team for that purpose. All
right. Well, Doctor, thank you very much for speaking with us.
My pleasure. Once again.
Always a pleasure. Maybe we'll do a third one.
Sounds good.
All right. Thank you very much.
Yep.
And Calvin, look what we found here. Surprisingly, the supervisor of the town of Plattsburgh, Mr. Michael Cashman. Michael, nice to see you here.
Hey, good to be seen.
And you got to be excited to have this open up in the town of Plattsburgh.
It is. Healthcare is one of those really complex things in society, and when you are physically in this space, you can't help to feel that this is going to be one of those crown jewels in the healthcare system overall. We're very, very pleased that not only is the outside space creating a really warm, inviting corridor that complements Uptown, but what it means for service to help people is spectacular too.
It is a beautiful building. When you drove up here, I was like, wow, this is really top notch. The inside is absolutely gorgeous.
The attention to detail is second to none. We've worked with them right from the start through our planning board. The town of Plattsburgh really prides itself in working with individuals to onboard them as quickly as possible through a collaborative method. And what's really neat is up in Champlain, we obviously know within the region that they could be very successful and all throughout the state.
Now, as a supervisor, did your team of people go up to look at Champlain and see what was done up there?
We've had an opportunity to explore and to investigate all of their different products and services, and we knew that it was going to be a great fit.
So I'm assuming something like this, there had to be a lot of meetings with the town to get to this point, I'm assuming.
Yeah, there were a number of meetings, but really because of their professionalism and because that they put a good product on the table to begin with, we were really able to get through the nuts and bolts of it pretty quickly.
Okay.
So it was a good thing.
Now, did this take a lot of your time away from your day-to-day stuff?
It was one of the many things that I had an opportunity to sit on and be involved in those conversations, but I was really happy that it happened on my watch, not because it was about me, but you get to see the evolution of a project. You know, I was here at the groundbreaking, and now to be here today and to see what the final product looks like is pretty cool.
So anything, I don't know if you can say anything, but is there any things coming on the horizon in the town that the public would love to know about?
Well, you know, some people know that Kohl's is finally coming to the town of Plattsburgh.
Wasn't there a sign issue or something going on?
That was such a small and minor thing that we always knew that they were coming. We have Runnings coming, which is out in Malone now. We're being scouted by 2 other national or international businesses. We hope to have some more announcements coming up in the fall.
Nice. Now, is this in the mall area or somewhere in the town?
Within the town.
Okay.
So, you know, we do a lot of recruiting and we do a lot of showcasing. We believe that we have some other good things to show, and then the Plattsburgh International Airport continues to see some expansions and opportunities. So
unbelievable what they've done out there, isn't it?
It really is. Here's a fun little fact for you. Last year alone, $25 million was invested in the town of Plattsburgh.
Correct.
Okay? The year before that, $50 million. So within 2 years, over $75 million of private dollars was invested in our municipality.
That's incredible.
That really is.
So when you go back to the airport, how many travelers can we handle now, or are we handling? Do you know that number?
You know, Chris Krieg and you know, Mike Zerlo and Ronnie Brown and those folks could answer the numbers better. I can tell you that everything is giving strong indicators that they're meeting the expectations, they're exceeding expectations in many of their arenas and markets, and it will only provide new and good things for us.
And I'm assuming, and you're still working on other carriers, I'm assuming, to try to come into there.
They are, and part of what you need to do is you need to provide the opportunity to have a space to bring them in. The TSA was a huge component of that.
Yeah.
I don't believe the county is taking, you know, the philosophy of build it and they will come.
Right.
They've really proven out some of those concepts, and we're cautiously optimistic in the next several months some more good things will occur.
So now, how many years have you been the town supervisor?
I'm wrapping up my 4th year.
And your term is for how long?
It's a 4-year term.
So you got election cycle this year?
It'll be up this November, yep.
Wow. Now, are you running unopposed, or do you have a challenge?
As of right now, there is not an opponent, but, you know, I'm loaded for bear, as they say. You can never take anything for granted.
So
and
right now, nobody's going to try to primary you.
No one's going to primary me, but again, you keep marching forward and be as accessible and, you know, listen, learn, and lead.
So one term.
Yep.
It's coming to an end. Obviously, you love it. You want to go for a second term.
I do.
Okay.
You know, one of the
It
major
becomes part of you, doesn't it?
It really does. And for me, one of the major focuses has been on the infrastructure. We've been working on a $24 million water capital plan that includes our water towers, our wastewater. We're working on a new 2 million gallon water tank.
Wow.
We did the corridor painting on exit 37 and a number of other things. So that's part of the reason we're seeing success. We focus on the health and safety, sustainability, and economic development of our community. And those businesses that come in will often ask us about our infrastructure.
Sure.
We've got good infrastructure.
Right.
Good bones.
Obviously, in having something like Hudson Headwaters will help with that growth too.
It is. You know, when we're fortunate enough to get a business or a company to come in, we load them into cars or a bus or what have you, and we'll drive them around the greater region. so that they can understand it's not just about Smithfield Boulevard or Tom Miller or any of the particular corridors. We want them to experience the region so that they understand that they're investing in a place and a people, and we all know business is about location, location, location.
Of course, being a realtor, I do understand that probably better than anybody. But you know, for yourself, I know you aren't taking any credit for anything, but you are the current town supervisor. So congratulations on this W during your term.
Thank you. I appreciate it. And I just want to express to everyone that's watching at home, congratulations to them and congratulations to our community for embracing opportunity, because that's what it takes, is a community that says we need something and we're going to find a way to get it done.
I was saying that to the doctor. One thing about Plattsburgh, the North Country in general, it is amazing how the parties come together and get things done.
Absolutely.
And we have a history of doing that, and this is another positive outcome of that.
Yeah. My grandfather used to say that the only thing is constant in the world is change itself. And we've seen a lot of changes over the years, but I think we have some more to come.
Absolutely. Well, Supervisor, thank you very much for coming on camera with us.
Thank you.
Crab Island.
Crab Island. Okay, Crab Island. Calvin's asking about crab. There must be something I'm not aware of.
So one of the things that we're working with is the Clinton County American Legion. We are working on what's called the Battlefield Memorial Gateway. It's basically a veterans park on the old jetties that were connected to the fueling station of the old Plattsburgh Air Force Base. It is going to be a one-of-a-kind space that's going to connect to Valcour Island, which represents the American Revolution. Crab Island, the Battle of Plattsburgh, bringing it back to the jetties, and it's called the Triangle of History. We're already working on it, and we're going to be meeting with Hometown Cable soon to go into more detail. We're super excited about this.
Well, Calvin, thank you for that. Appreciate it. Again, Supervisor.
Thank you.
Cashman, thank you very much. All right.
Hi, everyone. We're going to go ahead and get the program started. Hopefully you've been enjoying the food. Come on up to the front. Don't be shy. I could use the microphone feedback trick to really get your attention, but we do want to, on behalf of the team at Hudson Headwaters, my name is Dominic Pizarro, I'm the Chief Operating Officer. I'm going to be your MC here tonight. I'm very excited to be here, but I'm much more excited that you are here at the ribbon cutting for the Hudson Headwaters Plattsburgh Family Health Center. And like most big efforts that are a long time coming, it involved a lot of important partners, and we have many of them here today. We certainly have our friends from University of Vermont, but the president of Champlain Valley Physicians Hospital, as well as the president of Alice Hyde Medical Center, Michelle LeBeau. Michelle's going to be speaking with us, so welcome, Michelle, and thank you for your partnership. Also to University of Vermont Health Network, thank you to Dr. John Brugstead, the President and Chief Executive Officer, as well as Dr. Howard Shapiro, who's a great partner through this whole venture. Howard is the Chief Population Health and Quality Officer, and also to John Remillard, the President of Elizabethtown Community Hospital. There's John over there, so welcome, John. Also, thank you to all the Hudson Headwaters staff, and I especially want to thank not only the 22 staff members that we have here at Plattsburgh Family Health, since we officially kind of started accepting patients February 4th. They've gracefully made it through kind of all the speed bumps in any new venture, any new health center. But I also want to acknowledge some staff who put in extra effort from Champlain. So folks like Melissa Gooley and Ty Condorogo, like Brenda Duchesne. They've done a real yeoman's work and helped bringing this together, as well as thank you to all of you. And we do have a longtime friend and leader who just recently retired, Donna Gorton, who is our Director of Nursing, who did a great job in helping us put that together. Thank you, Donna. Thank you for We also have some of our Hudson Headwaters board members here, as well as the Executive Director of our foundation, Executive Director Jessica Rubin, Chair of our board, Ike Woljan. We have Kathy Moses and Celine Paquette from our board, so thank you for making it all the way up here, except for Celine, because you're kind of local. And thank you to all the many community partners and leaders. So I could talk to you about all the great work that this health center is going to do, but that's not my role here tonight. We have people who are much more articulate and much smarter to do that. So we've got several speakers that I'll introduce briefly. But I do want to say that Hudson Headwaters has been committed to providing access to comprehensive primary care services for the last 40 years in the Adirondacks and the Greater Glens Falls area. And we made our way up into Clinton County in 2012 as we entered into Champlain. And it was really 2 years ago around this time that we had a grand opening of our Champlain Health Center. And that's just grown tremendously. So we're very thankful for that. Our mission is to provide the best health care. Thank you for your feedback. And access to that care for everyone in our communities without regard for their ability to pay. So it's certainly a noble mission, and our status as a federally qualified health center allows us to do that and use tools like sliding fee scale and kind of means testing to say, whatever your insurance status is, whatever your ability to pay, please come into our doors and we'll welcome you. So it's a great mission, and we've had some great partnerships to help continue that mission that's going to kind of move forward with the ribbon cutting today. So I mentioned Michelle LeBeau is going to speak. We're also going to have Michael Cashman, who is the Plattsburgh Town Supervisor. We thought that was a good idea since we're here in his town. Shelby LaRock, who's the Constituent Services Manager, got that right, for Single Unit Billy Jones' office. And then we have Joel, there's Joel, and he's the Regional Director at the Plattsburgh office for Congresswoman Elise Stefanik. But my favorite fearless leader is going to kick us off, and that's our CEO of Hudson Headwaters, Dr. Tucker Slingerland.
Thanks, Dominic, and thanks everyone for coming today. There's really an amazing story to be told with this building, and it's one chapter of, I think, a number of great accomplishments for our region. The story really starts back with finding folks who are like-minded, and I think we recognized that very quickly with leadership at CDPH, but also the University of Vermont Health Network. And with that, as we planned our facility in Champlain, we designed a building unlike anything we had done before, which really had space dedicated to CDPH to provide ancillary services. And that was a huge asset to patients because they could very conveniently get those services done. But so building on that with the same folks and the same internal operational people, we launched planning for this building. And it seems like it wasn't that long ago we were breaking the ground here in the snow. This building is especially, I think, impactful. We, during roughly that time period, had done some work trying to estimate what the potential need would be in the Plattsburgh community in the future around primary care, and realized that we really needed at least 6 physicians in the future and probably 6 APCs. So the charge was to build a building of that size, and CDPH very bravely took that on, secured grant funding and other funding to make this possible. And then our assignment was to staff it. And recruiting that many medical providers here on this scale is not something we had ever done before at Hudson Headwaters. But I'm very happy to say that we succeeded, and we met the need, and we currently have 12 providers that work out of this building, or will soon, as a few graduate from the residency program here in Plattsburgh that we've hired. And with that, the building has 22 folks working here, which is a workforce and a presence that didn't exist before. So I think it's a potential economic driver as well. But I think the thing that probably matters to all of us the most is what this means for patients. And I was very interested to see. So I was here the first morning. I'm a family physician, so I put on my stethoscope and jumped in the mix and saw a few patients. And I met folks who had not been getting care because they had transportation issues and had taken advantage of the bus line coming here. So that was great. I met a very patient businessman here in the waiting room who had been looking to establish care for, I think, over a year. So he had to wait a little while as we checked him in because he was our second patient and the systems were new. But he said, no, I have no problem waiting. I'm thrilled to be here and so excited about the space. And so it was all a bit of an experiment. And the most amazing thing to me is that to date, we have enrolled 2,400 patients into services here in this facility. So and there's absolutely no way that any one organization could have met that need. This building, to be clear, is as much a CVPH and UVM effort as it is Hudson Headwaters. And it's the combination of the expertise across organizations that really is impactful. And so those patients, this means a lot to. So we've seen 3,500 encounters here in under 4 months, which is way more than we were anticipating, and the building's certainly designed for that. It can grow, and folks are coming for an array of services from behavioral health to primary care to substance treatment. So we're really excited about that, and it's approaching 1,000 patients a month, which so I think that there's a real need here, and people will appreciate this, and that the community should be proud of it. And we'll do a lot more to come. Speaking of which, I'm a firm believer in integrated delivery systems because that's what this is, and this is a coordinated project that resulted in a lot of good. The residency program that CVPH launched was another bold experiment that succeeded. Hudson Headwaters helped that expand by 2 residents a year using our CVPH site. So. That's the workforce that the North Country needs, and rather than waiting for someone else to solve that need, together we figured out how to do it, and we're doing it. So I think that's exciting. And lastly, our next big project is with our friends in Elizabethtown and Ticonderoga, where a new health center will be built as part of the Elizabethtown Ticonderoga campus. We'll move our current health center in Ticonderoga over into that space. But like here, it's positioned to be down the hall from laboratory services and imaging and specialty services, and really is a campus, potentially a model for the region about how you deliver healthcare, especially in rural communities. So we should all be proud of this building. I hope folks here feel that way and use it as patients, and we will go from here. But I'm very happy to pass the microphone to Michelle and enjoy.
Thank you all for being here as we venture off into what has been probably one of the most exciting things that Hudson Headwaters and CVPH have done together. It's interesting when you actually can find 2 organizations who believe in the same thing and find their pride and their power from bringing something to a region that so desperately needs it. So CVPH has worked with Hudson Headwaters in our 2014 upbringing of our residency through UVM Medical Center and through UVM Medical School. We're graduating 3 residents at the end of the year, all 3 of whom will be staying here locally because we have this wonderful group to work with. It's exciting, it's challenging, it's wonderful to see young people who want to stay in the community and are committed to raising folks. As a parent, as a nurse, as a hospital leader, as a community member, knowing that we've got this great collaboration between the 2 places brings us to a space where we can actually continue to provide high levels of care. Tucker talks very eloquently about what it is that we need here, what Hudson Headwaters can bring, and how CVPH folds right into that. So I'm excited to share this time with you. I'm excited for what's coming. I'm excited to be able to look at the residents of our beautiful community and say, there will be people here through this collaboration who will continue to care for you through the years of your lives. So thanks for having us.
Thank you, Michelle. Michael Cashman, the town supervisor up.
I'm going to.
Just go low. There you
All
go.
right. I'm going to attempt to do something that very few politicians try to do, and that's be brief and be seated. If I hurt myself, there's medical here, so that's. I wrote that one myself. In all seriousness, folks, partnerships and collaboration are something that I think the North Country really specializes in. And when you're a town supervisor, you have many opportunities to connect with folks around the state and the greater Northeast. And when you're able to talk about things like Hudson Headwaters coming into your community, people take pause and they say, how did you secure that? How did you link that into your community? And right now we're seeing historic investments in many arenas of our community that we can be very proud of. From the infrastructure to the Plattsburgh International Airport, to our college community, all those types of things, but that doesn't matter unless you have a healthy community. Unless you have a community that can wake up every day and feel comforted by the fact that no matter where you are on the age spectrum, that you're going to have the services and the affordable services to be able to maintain a lifestyle of activity and good health. And we're really, really proud that the town of Plattsburgh now becomes part of that triangle of health in our greater region. I could go on at length for the many people that I want to thank and congratulate, but I actually want to draw attention to Chris Booth. The reason I want to do that is the town of Plattsburgh only played a very, very small part in this. But what we're happy to do and what we want the greater public to understand is we are excited to see projects like this onboarded in our community. Chris and I met numerous times and we had to kind of jump over some hurdles, maybe crawl under some hurdles, go around some hurdles, and that's our commitment as a town. We want to be a partner in whatever way you folks are going to expand, because we know, we're already thinking about it, we know you folks will expand. Because what you're doing here in the community is not only meeting a need, it's paving a future for our entire region. Thank you very much for all that you're doing.
Thank you very much. Michael brings up a great point. Chris Booth and others from UVM and CVPH did such a wonderful job in constructing this facility actually ahead of time. And the New York State Department of Health was a great partner as well with a capital structure grant to help us with the financing and getting all of this rolling. So now I'd like to welcome up Shelby Rock from Assemblyman Billy Jones' office for a few words.
Thank you. The Assemblyman is in Albany, unfortunately, and he couldn't be here, but he did prepare some sentiments for me to share with you. I regret I am not able to join all of you, but would like to offer my most sincere congratulations to those who made this collaboration possible. University of Vermont Health Network, CVPH, and Hudson Headwaters Health Network have come together once again to improve healthcare in the North Country and increase access to primary care for residents. This partnership is a prime example of what can be accomplished when two organizations work together for the benefit of the community. As the need for mental health services is so high, I am so pleased to see access to these providers included in Plattsburgh Family Health. The primary care mental health model is one that should be implemented more often, and I am confident that this health center will pave the way for others in the future. Best wishes to all in attendance, and thank you once again. I am excited to see what the future holds for this facility.
Thank you, Shelby. Now we have something kind of cool. We're going to have Joel Wood from Congresswoman Elise Stefanik's office, and he's got something special that he wants to present to Dr. Slingerland and Michelle LeBeau.
Thank you, Dominic. I do have something special that I'd like to present, but before I do so, I just want to let everybody know that the Congresswoman also regrets that she cannot be here today. The House is in session and she is required to be in Washington for votes. However, she does want me to pass along her congratulations and convey her excitement on this wonderful partnership and this new facility that we're gathered here today to celebrate. So since entering office, the Congresswoman has had the opportunity to work closely with Hudson Headwaters and CVPH, meeting with their staff on multiple occasions, both in Washington and in the district. These meetings have helped better inform her work in Congress and have allowed the Congresswoman to better support their mission of providing access to quality healthcare services for all residents, regardless of insurance status or ability to pay. Community health centers serve over 95,000 patients in New York's 21st Congressional District, and glad to say that it'll be more now. And the Congresswoman knows firsthand that strong and affordable healthcare in our rural communities is critical. That's why she and the 115th Congress was proud to lead the legislative effort to secure $7.8 billion in community health center funding nationwide, and why, as co-chair of the Community Health Center Caucus, the Congresswoman will continue to advocate on behalf of these centers in the 116th Congress and work to prioritize the unique rural healthcare needs of our district. She's going to work hand in hand with Hudson Headwaters and CVPH to do so. And as Dominic mentioned and foreshadowed, to commemorate today's special event, the Congresswoman did provide me with a congressional certificate that I'd like to present to Tucker and Michelle.
And put some Vaseline on the teeth to hold that smile. Great. Well, thank you for that, Joe. We appreciate that. So, just kind of in closing, this is really about access. It's really a story about access to patients, and there's a couple things that we're going to be doing that are a little bit more progressive here in Plattsburgh, and some things that we've been trying in our other health centers. One is in partnership with CVPH. We've actually got a system in place that CVPH in their emergency department and in their inpatient setting, when a patient is leaving the emergency department or inpatient setting, being discharged, they'll have direct access to the schedule here so that they can schedule follow-up appointments for those patients to come into the health center, because that's such a critical time of transition. So we've worked through that, and we really appreciate the partnership, and it just goes to show the partnership doesn't stop with the construction of the building. It continues, as Tucker mentioned, in integrated care. The second piece is we're actually going to be, we've kind of quiet launched this, but if you're a user or a patient of this health center and a user of our portal, so our handheld application or desktop application, we're going to be giving patients the ability to schedule appointments, certain types of appointments, new patients especially, follow-up visits and sick visits, patients who have an acute problem that needs to be addressed, with Dr. Jacques and with Dr. Cook here at the health center. So we're going to be working with that. It's kind of more a reflection of kind of what patients, what the rest of their lives look like. So we're trying to get healthcare to look a little bit more like that. And then the last piece, but I don't want any of you to hit the buttons on the way out. There's a little guy there at the end, a little kiosk right near the door that it's called Happy or Not, and it has smiley faces. And we want to understand, it's one thing to give access to patients, but we want to understand how was your experience with Hudson Headwaters. So you can look at it and read it. Please don't go tapping, on there. We have enough bright little children who do that. So, and Dr. Sawyer, our Chief Medical Officer, I see up there, does it once in a while as well. But we want to thank all of you for coming, taking time out. Want to thank our caterers. We had them here back in February. They did a great job then. We want to thank them. Again, thank our partners for doing all that they've done, and we look to continue to do great things with them. So here's what's going to happen now. We're going to have a official ribbon cutting over there. So we'll ask our Hudson Headwaters kind of team and other folks to kind of gather over there. Then we're going to be doing some tours of the health center that will be over here. So we'll start tours. And then what else did Maggie put here for me? Oh, so I hope you practice your mingling, because we're going to mingle for a little while after that. And then we're going to have food until 6 p.m. And then she wrote down And at 6 p.m., you don't have to go home, but you can't stay here. So thank you for coming, and I hope you enjoy the ribbon cutting and the tours. Thank you very much.
It's a pleasant afternoon still, so we all stepped outside. And the ribbon is in front of the building, in front of the entrance. But Michelle LeBeau and Dr. Slenderland are going to be holding the scissors.
Okay, everybody, hold it. Count of 3, does that work? Ready? 1, 2, 3.
There we go, 5:05 p.m. The ribbon has been cut there.
Thank you.
June 5th, 5:05/6/5/2019. We're going to kind of follow along here. We may not be able to pick up the speaker, but we'll follow along and take a look through the facilities.
So yeah, it's based on pods, and then you have like in each pod you have like this is for behavioral health. So this one's not filled right now. Some people are coming in as we get more patients.
I think there are 20 pods.
So this is
Should be rooms to see patients.
She said she's like you're gonna be confused. Point of care, I think. So they do different things in there. You know, the nurse kind of center.
Nurses station.
Oh, the guy behind. Calm down like that. So these are all different.
Patient rooms.
Little photo shoot in there earlier. So each provider works in different pods.
You can see an eye chart
You hear
here.
us call that a lot. And then within the pods, there's different exam rooms. So we have pods for type 2.
So this
pods,
is
yeah.
very similar
2
here
pods,
to
so
Champlain, where they
providers all
have a
sit together so they can talk to each other.
a station like this in the back of the facility.
Combine the patient
So they
care.
don't have their own separate
office. Right. So they work together, and that's why like a lot of our care, and we have like doctors and physicians assistants and practitioners. So I do know they'll like chit chat within each other about stuff, and that really helps to work together.
Where are your nurses?
They're sitting right in here too.
Oh, as well.
Yeah.
So anyone.
So I imagine when they call you in, they give you a door number to come to.
Yeah.
And there are signs leading you to
So they each have their own.
your exit.
That's kind of cool.
Yeah, and in the middle is our telehealth nurse, so that's where like our RNs that do telehealth sit. And most of our nurses that work with providers are LVNs.
Okay.
To do rooming and
So,
things like that. So
exam
then they
room
work, so
14.
like this pod works these 2 hallways, and this is called pod 2.
Okay.
And then it's,
So it just makes like this loop. If you came in here, you check out there. But there was a checkout.
Well, I don't know if you, so their checkouts are not like fully established yet because there's only, it's been a slow process. We started even with less providers than we have now, and we're getting more, and then again, more later on this year too. So as they start to fill in, we'll start to expand into different areas.
Okay, so you potentially have like 3 places to check out. So ideal.
2, one for this pod and one for that pod.
Okay.
And then the wall of desks at the front would be for like check-in.
Yeah.
So you come check in, sit, and then you see your provider, you get seen there.
So you're gonna take me.
Our tour guide is Lisa DeLong. We got
Okay, so
Mrs. David Dumas here. What's her name there?
Emily Dumas.
Emily Dumas. Kayla Breen from the Press Republican.
This is where our providers will, or our nursing staff will take care of testing, such as strep test or blood test, and just different types of testing.
Do you have walk-ins?
We are not a walk-in clinic per se, but we're taking all new patients. So because of that,
You can get an appointment quick.
yes, we try very hard to let people know that if you want to be a patient here, we will go right ahead and try to put you in. We are open access, and as Dominic had said, we're going to be very shortly allowing patients to schedule their own appointments. So each hallway is connected by this little area where there's a soiled and a clean room and a bathroom for patients. I think we went by the pediatric room. Each room, we have a bariatric room. This is a pediatric room. So it has, of course, the infant bed and the pediatric bed. We have the beds that move up and down for people who cannot climb. And of course, we have the high storage beds also. Each, let me see, we have 20 rooms. This is the nice side because we have the windows. This one doesn't, but most of these have windows. And as I said, when you get to the back, we have areas where the providers can collaborate with nursing staff and coordinate care. We have a care manager's office at the end of each pod, and that's down the second set, and that's just simply so that they too, a care manager is somebody who will help people overcome struggles, barriers. So they too will have access, providers will have access to them if they need to have them speak to a patient. We haven't gotten to the point where we actually have a care manager here yet, but we have 2 rooms for them. We also have down the next hall, I'll show you a consultation room. This back door here is our ambulance entrance. So when the ambulance comes, they press a button and it'll overhead page that the ambulance is here. And we don't hear that in the front, but everybody back here can hear it.
That's mainly for people leaving here, not, you don't get ambulances delivering here, do you?
If we call 911.
Right.
So that they can.
So they're not delivering patients here?
No. We're delivering them to the
right.
hospital.
Right. So, again, it's similar to Champlain.
If somebody comes in with, if somebody comes in with an emergency, we will stabilize them. And if the care needs to go to CVPH, that's how we work that. These pods are nice and open, simply for the communication, but yet at the end so that there's no patients back here. Mm-hmm. So the privacy is the privacy is number one, obviously.
Yeah, they can talk freely.
Yep. We have here treatment rooms, a little different than Champlain. They have procedure rooms. Oh. So our treatment room does not have gas on the wall, but this is typically where a person who has an emergency would be brought. And they might be able to also do maybe office surgeries in here if it was a little bit more complicated than like just taking off a small lesion. They might do that in here. There's a little bit more supplies. And as I stated, our care manager's office is right here. So this is very close to this pod. They will be able to just access this person and get patients help with the barriers that they might be having. Mm-hmm. And like I said, we have a medication room in both pods. The only one that has access to this is nursing.
What are your hours?
Our hours are forever changing, but Monday, Tuesday we're open at 7:30 and we close at 8, and Thursday. Wednesday we're open at 7:30 and we close at 5. Friday 7:30 we open and we close at 5. Saturday we're open from 7:30 to 1. Word has it that in the fall we're going to be open long hours on Wednesday night also. So more to come on that.
Right.
Yeah.
It's evolving.
We're going to probably mirror our Champlain office when all is said and done.
Now, is much of the staff interchangeable, or are you pretty much autonomous each site?
We do share staff.
Okay.
We've had plenty of help opening this up with not just Champlain, with Ticonderoga, North Creek, some of our Queensbury offices. Nursing staff has been phenomenal. They come up here, they're still sitting with our phone nurses while we develop and train our staff. Almost all staff here is new. This is our newest front office staff, so patient services. And so as I was explaining to Emily, I said just this week we got our practice leader. We got a new nurse leader. and we got a clinical leader. So everything happened this week, and it's, you know, we've been open since February, so this is good news for me. I'm the patient services leader.
Help is on the way.
Really, really good news for me. This is a consultation room. They use these types of rooms for a variety of reasons. Down in Pod 1, we use it for AHI, which is Adirondack Health Institute. They help to facilitate patients, help them to get insurance. They're here Monday and Tuesdays. They are awesome. So they use the room over in Pod 1. Sometimes we'll have consultation rooms that are used by providers that, we have a MAT program up in Champlain that helps with Suboxone patients. Just a variety of different uses. Right now, our behavioral health 2 room has a teleconference ability in it, and that's so we don't have a care manager here yet. So they're using the care manager from one of our southern offices, and she meets with patients and does a teleconference. And we can utilize Champlain if we needed to also. Oh, and there's Eric. I should show you his beautiful room.
Oh my goodness.
Can I?
Sure.
I'm taking you down into Pod 1 right now, but it mirrors, like I said, Pod 2. But this office, you don't want to look in it right now, Oliver. This is really nothing at the moment, anyhow.
It says triage, but it's
Yeah.
future triage.
This is what our checkout looks like in the back part of it.
Oh, okay.
It's nice and big, and like I said, we have a checkout for Pod 2. This is the checkout for Pod 1.
Is it always this crowded?
Not yet. No, I think we'll need a lot more workers if it gets that crowded. The artwork, I should talk about that. This is from the Strand Art Center.
Mm-hmm.
It's a rotating art. It comes, David Manette brings it, and I think it's every quarter. The pictures are all for sale. This time it's watercolors. They had photography. It's really beautiful, and it's nice. It's changing all the time, so patients don't have to look at the same pictures. And here we go. This is Eric DeSalle. He's our behavioral health. He is our first behavioral health.
Yeah, hopefully not the only.
Yeah,
We can
hopefully
have
not the
some
only.
more
He wants to feel
help,
like I
guess.
do right now. He wants to have some help.
Yeah, and we
This
got
is
quite a
his
few.
room, and he's decorated it so nice, so I like to show people this room. He tries to make the patients feel comfortable and
More calming in there
calming
than in
and-
the exam room for
Yes.
most people.
Yes. And as I said, we have, I could take you down to the end and show you the access over to CBPH. And that's a really nice feature also. Oh, I didn't see this one yet. You have any questions? It's pretty, I mean, they're pretty much, like I said, Champlain is built the same way, except they have 3, so it gets a little confusing in the middle. 3 pods.
Yeah.
But they're all built the same way. We have just a communication room. We have a janitor's room. All these stay locked. We have a maintenance room. Our back door is our receiving door for UPS, FedEx, and they go right into the receiving room. But this is a nice feature. This is an access over to the diagnostic center, and this is the breezeway that they built. And we have 2 accesses, one here and one down through the employee entrance.
This was the former outdoor part of it.
And so it's nice for patients also. They can stay undercover.
Right.
And even if they have to go outside, it's still kind of under, yeah.
Right.
And then I'll take you down, the last piece of it is our employee hallway. This stays locked normally, and the only people that have access down this hallway is employees. We do have a lactation room. It can be used for patients if there's not a room available, but this is mainly for employees. This is a provider lounge. Dr. Cook calls this her study hall. She likes it in here at lunchtime. It's quiet. You guys got this already. So here I go again. You kind of, well, you'll know your way around when you start.
Exactly.
That's the first place you wanted to know is where the lounge was, Emily?
No.
And then, of course, we have our break room, which is probably a little bit messy right now because the caterers are in there, but here they all are. It's a nice big break room.
So you have these caterers every day too
We
for the
would
staff?
love to have them every day. I don't know. We could add them to the staff. That would be perfect. We have a nice conference room. We can video down. We do all of our web conferences in here, so we can meet with other staff members of Hudson Headwaters and do our training in here. It prevents us from having to do a lot of travel. That's really nice. And then, of course, this is the patient services area, which is a little bit of a wreck right now. But typically it's not a wreck. We have my office and practice leader's office. And then we have a nice big workroom around the other side that holds our and there's patient charts in there, so I won't take you in there. But this is it. That's it. We're back around the front.
So this is where people check in when they come here, right?
They check in here,
During
and
what?
typically our front office staff knows how to, all of them know how to check in and check out. So if you're sitting in check out and you have nobody there, and we're filled in check in, which happens often with new patients, it takes a bit of time to get them checked in, and almost everybody is new, so they end up over on the other side.
Okay.
So, yeah.
All right.
And
Thanks
our
for the tour.
practice leader just snuck around the door. Okay, bye, thank you. I won't.
So we're going to wrap up our grand opening look at the Plattsburgh Family Health Center, part of Hudson Headwaters Family Health Network, located here in the plaza across from the Miramar. Excuse me, not Miramar. Miramar used to be in Champlain. The Champlain Centers, which we used to call Pyramid Mall, but the Champlain Centers parking, shopping area, and of course we're all familiar with the Hannaford, which used to be Sun Foods many years ago. So this is the area it is, and it opened in February of this year. The health center ensures access to primary care services for North Country residents. The Plattsburgh Care Services are provided by Hudson Headwaters Health Network in a 19,125 square foot building built by University of Vermont Health Network CVPH adjacent to its diagnostic center. It features 20 examining rooms, 2 treatment rooms, 2 behavioral health rooms, and 2 private consultation rooms. Has established 1,800 new patients since its opening, and one of the great parts of the location here is a convenient location located to the CVPH Health Plaza, which includes the H.K. Friedman Renal Center, the Women's Imaging Diagnostic Center offering X-ray, EKG, blood tests, and other lab services. The Kevin J. Carroll Ambulatory Surgery Center also offers pain management. North Country Regional Blood Donor Center, the Wound Care Center. We took a tour of that facility when it opened up a couple of years back. And Gastroenterology Associates of Plattsburgh. It's located on a bus route. The hours, once again, are Monday, Tuesday, and Thursday. It says 8 a.m. here, but we were told it was 7:30 a.m. to 8 p.m. Wednesdays. They close Wednesday and Friday. They close at 5, and Saturday they close at 1 p.m. And of course, that's all subject to change in the future as things progress. So it's a floating schedule, which will only be expanding as the days progress. So thanks to Joey Trombley once again for stopping in and handling the microphone for a couple of interviews. And another job well done here for CVPH and for the Hudson Headwaters Health Network. Thanks for watching viewer-supported local television, Hometown Cable. We've been coming at you from our Plattsburgh location here in the beautiful, just outside of beautiful downtown Plattsburgh.